Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe is a medication used to treat a skin condition called eczema, also known as atopic dermatitis. It belongs to a class of drugs called monoclonal antibodies, and it works by blocking a certain natural protein in your body, called interleukin-13, which may cause inflammation and swelling in eczema. The daily dosage and optimal timing of this medication should be determined by a healthcare professional based on individual needs and medical history. Be sure to follow their instructions carefully for the best results. Before you start using tralokinumab, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is typically injected under your skin once every 2 or 4 weeks, as directed by your doctor. The injection can be given in the upper arms, thighs, or abdomen, except for a 2-inch area around your belly button. The dosage will depend on your medical condition and how you respond to the treatment. If you are administering this medication at home, it's important to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using the medication, it should be brought to room temperature for at least 30 minutes. Avoid warming it up in any other way, such as in the microwave or hot water, and do not leave it in direct sunlight. Make sure to check the medication for any cloudiness, particles, or discoloration before using it, and do not use it if you notice any of these issues. Clean the injection site with rubbing alcohol before injecting each dose, and rotate the injection site each time to minimize skin injury. Do not inject through clothes, and avoid injecting into tender, damaged, bruised, or scarred skin. To reduce bruising, refrain from rubbing the injection site after administering the injection. Also, ensure that you learn how to store and discard medical supplies safely, and do not reuse syringes. It's important to use this medication regularly to get the most benefit from it. Consider marking your calendar with a reminder to help you remember when to take it. If your condition does not improve or worsens, be sure to inform your doctor. When using Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe, you may experience redness, swelling, or pain at the injection site, as well as swelling, redness, or itching of the eyes or eyelids. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, if you do experience any serious side effects, such as signs of infection, like a persistent sore throat, fever, or cough, or other eye problems, such as eye pain or changes in vision, it's crucial to inform your doctor right away. While very rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to remember that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's best to contact your doctor or pharmacist for guidance. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before starting tralokinumab, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain ingredients that can cause allergic reactions. Also, let your doctor know about your medical history, especially if you have a certain type of infection called helminth. It's important to inform your healthcare professional if you are using tralokinumab before getting any immunizations or vaccinations, and before having any surgery. Make sure to tell your doctor or dentist about all the medications and products you are using. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe safely and effectively. Always follow your doctor's guidance for the best results. If someone has taken too much Tralokinumab-Ldrm and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911. Alternatively, you can contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to your provincial poison control center for guidance. It's crucial to act quickly in these situations to ensure the best possible outcome. This medication should only be used by the person for whom it was prescribed. Do not share it with others. If you forget to take a dose of Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule. It is important to store Tralokinumab-Ldrm 150 mg per milliliter subcutaneous syringe in the refrigerator and avoid freezing it. Keep the product in its original carton to protect it from light. It can also be stored at room temperature for up to 14 days, but if stored at room temperature, it should be used or discarded after 14 days. When it comes to disposing of this medication, it is important not to flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and it is recommended to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.